Fuel tanker, a couple are trapped in a crushed car.
It must be absolutely terrifying to see people inside this car.
Terror at the top of the tower block as medics treat a seriously ill man.
No.
Vic, we need you to calm down.
I'm really scared.
And Mari and I get interrupted
We need to go, that's the job.
by the most urgent call of all.
Oh, it's a cardiac arrest, let's go.
A UK air ambulance, the front line of medical care. With twin-turbine engines, it can fly at speeds of 180 miles per hour, reaching locations that land ambulances can't. Now, what's lacking in here is space. We've got these tiny little cameras set up inside the helicopter. This is Ange Cam. This will get my point of view of whatever incident we're going to. Between all of these little kind of modern technology units and me, we should get a good picture of what's going on. The medical team will also wear cameras. I'm flying with Kate, a paramedic for 14 years, 4 on the air ambulance. And Paul, 20 years a paramedic, 8 on the helicopter. Our pilot is Rob. OK, so this is where all the serious incidents happen. Great, well, I've got my serious suit on. And yeah, well, let's get cracking. And for the team, some serious business has just come in.
What have we got?
RTC, oil tanker versus car entrapment.
Oh, not good.
A fuel tanker and a car have collided on a country road.
Any more details come through about buses and the state that they're in?
All a bit sketchy information at the moment. They think there's more than one trapped, but the information can vary quite a lot, so we'll soon find out.
Oh yeah, it's right on the junction.
Police have sealed off the crossroads. Firefighters and crews from land ambulances are crowded around the smashed car. The force of colliding side-on with a tanker has crushed the car against a road wall. A couple are trapped inside. In the passenger seat, Angie's taken the full force of the impact and is the most badly hurt.
I know, Angie.
As well as a potentially serious injury to her right arm, she has pain in her spine. While medics treat her, a firefighter holds her neck steady, preventing any further damage.
Hello, Angie.
Hello.
All right, are you okay there?
I'm shaking now.
I know. We'll get you out as quick as we can, but we need to do things pretty slowly at the moment. All right, Angie.
The way they make these cars now are so safe. Luckily, I mean, you see an oil tanker going into a car, and this could have been horrendous. This could have been awful.
But such a heavy impact means that Angie could have internal damage, as well as an injured arm. Paramedic Paul wants to get her onto the air ambulance and to hospital as soon as possible. But she's in too much pain to move. Angie's been given morphine to swallow. Ideally, the team want to inject the painkiller directly into her bloodstream as it's faster acting. But with the tanker jammed against the passenger door, they haven't got the space to get a line into her arm.
Do you think if we move this truck it would cause a problem?
I don't know, because I think it's that that's holding the door.
Moving the truck is the only way to get to Angie. But doing that could move the car as well, jolting her spine and risking irreparable damage. It's just not an option. The medical and fire crews need to work quickly to find a solution.
The car too much.
Right. Are they happy with the safety of the tanker?
I think so.
Paul and Kate consult with everybody at the scene.
Obviously it's a fuel tanker.
Yeah, he's not leaking.
I don't know whether you're able to do a B-post rip.
We could try a B-post rip.
You okay there?
Yeah.
If you need anything, just shout, okay?
No worries.
Plan B. Fire station manager Graham Rook explains how they're going to get the couple out.
The first thing that we're going to try and do is go in through the boot and actually remove the back seats and actually bring the front seats forward to bring the casualties out on spinal boards out of the boot.
Angie's husband Derek is less seriously hurt. He's being moved first.
The options available to us, but as the casualty is quite stable.
It must be absolutely terrifying to see people inside this car. Just terrifying.
Carefully, the crews ease him out. The next part of his journey will be by land ambulance. Paul can now get a proper look at the more badly hurt Angie.
I think it could be dislocated.
Yeah.
So that's why it's so painful. Yeah, I know you are.
Paul thinks Angie may have a dislocated elbow, an extremely painful injury. She doesn't want to move it at all, but there's no choice. They have to get her out of this car.
Now, I will not lie to you, your arm may hurt, okay?
Oh, the moment Angie's dreading has arrived.
Just relax, relax, relax. Well done. You're doing really well. You're nearly on the board. Nice and slowly. Is that your arm? Yeah, okay. All right.
She's had quite a bit of morphine stuff, but that really hurt her.
Angela, big deep breaths now, this gas and air for me. I want about 10 of those that I can hear it.
Oh, I didn't know.
All right, keep going, big deep breaths.
She's getting lots of gas and air injury. Gosh, she really needs it.
You ready with that splint? Can you, in a minute, place that splint under your arm? Right.
Keep sucking. Keep sucking. Keep going.
Right.
Keep going. It's almost done.
Right, can you fold this over to me so it acts as a sling? Well done, Angela, you're doing fantastic, my darling. This is one of the hardest bits.
Ready, set, slide. Stop there.
Stop, that still hurts.
Ready, set, slide.
Right. Relax, relax.
This is far from relaxing.
Ready, set, move.
Trapped for an hour, Angie is finally free.
The relief of getting her out.
Okay, Angie, we're going to lift you up now and take you over to the air ambulance. You happy to come along in the air ambulance with us? All right. We'll look after you, all right? Well done. Okay.
We're flying Angie to the major hospital in Barnstable, the same place they're taking her husband Derek. But she'll arrive first, as his 30-minute journey in a land ambulance along winding roads will take us little more than 10.
Vehicles there.
The helipad is a few minutes from the hospital, and an ambulance is waiting. Kate, Rob and I say our goodbyes. Paul will ride with Angie to the emergency department, all the time reassuring her about Derek.
Well, when I spoke to your husband, he was chatting to me, talking to me. He seemed absolutely fine. He had a bit of tummy pain. Got the doctor to have a look at him, and the doctor's not over concerned at this stage. All right, okay. But he was put on a board as well, like you, because of the impact. Yeah. And it's. I think you might need a new car. All right.
Angie will be reunited with her husband in casualty, where doctors will assess the injury to her arm. If I could sum up my experience with the air ambulance crew in one word, it would be intense.
It's been quite a long day, quite an exhilarating day as well. You kind of have an hour maybe of sitting down and you get relaxed and you maybe open up a newspaper, and then all of a sudden the cream phone rings and it's just, you've got to be bang, ready to go, full alert, 100% ready to get into the ambulance, and you really don't know what you're going to get when you get there. Oil tanker versus car, that could have been absolute carnage, and it was very serious. But I tell you what, it could have been a lot worse. All it would have taken was 2 inches and that oil tanker would have gone straight into the side of the passenger door, and I don't think we would have been taking 2 conscious and breathing people out of it.
Of the couple trapped in the car, husband Derek came away from the crash virtually scratch-free. But his wife Angie suffered a fractured and dislocated elbow. Surgeons had to realign the bone under general anaesthetic, and she needed to wear a plaster cast and then a sling for 6 weeks while it healed. Coming up, a man lies bleeding in the street after falling backwards down a flight of steps.
You've had a fall. You've fallen down the stairs. We're here to help you.
And a man has vomited up blood. He's lost a lot and it could be fatal.
Quite a heavy hemorrhage here.
I want to invite you guys to come to church. You know, you might be thinking, do I belong? Do I fit? Is this for me? We always say Jesus Christ invites all to come unto him, to find rest in him. And all you need is a willing heart. So I hope we can make it easy for you guys. There are local missionaries that are in your area. They're there to serve you, to join you for a service if need be, take you on a tour, and maybe even introduce you guys to some lifelong friends. But mainly, they're there to help you find a place where you can find peace and comfort that can only be found through Jesus Christ. Church is a reminder of God's love for us. If there's a chance you might want to feel that, the link below will connect you with some local missionaries. They'll introduce you to your congregation and invite you to join a Christ-centered community. Hope you guys have a great experience. We're excited to see you guys on Sunday.
Meet with missionaries from the Church of Jesus Christ of Latter-day Saints to find a local Christ-centered community.
One of the UK's largest cities, Glasgow, also has one of the busiest ambulance services.
Ambulance service, what's the address of the emergency?
This year alone, they've dealt with over 87,000 separate emergencies. With a workload like that, they have to be tactical in the way they use their resources. Today, I'm going to be with paramedic Mari in a rapid response vehicle. Smaller, more lightweight than a standard ambulance, they can get about town much faster.
Hello. Hello, how are you?
Mari.
Hiya.
Angela.
Hiya, nice to meet you.
Very nice to meet you. Highly experienced paramedic Mari has been with the ambulance service for 15 years.
We are first responders. We'll probably arrive at the calls first before a double crewed vehicle.
Okay.
We will stabilise and give immediate treatment and then wait for a crew to come and back us up who will then transport the patient.
You're on the front line. What's the real picture?
Glasgow's a lovely city.
Brilliant.
It's the same in any big city.
Okay.
No worse, no better. We need to go. That's the job.
And it's one of the most serious calls a paramedic gets.
Oh, it's a cardiac arrest. Let's go.
A cardiac arrest means a heart attack has turned critical. Life-saving resuscitation is needed, and Mari's expecting she'll have to perform it as soon as she walks through the door. So time is... Okay.
The quicker that we get there, and the quicker that we can start the CPR, which is hopefully being done as we are reaching there. And then we're going up one of the busiest roads, with traffic back to back, people not looking.
With a case this urgent and city traffic unpredictable, Ambulance Control always send an ambulance as well if they can.
So nice to be at.
And at the address, one has arrived first.
Oh, there's an ambulance here.
There's already a vehicle here, so what we'll do is we will go in and make sure that they don't require any help.
Oh, look, they're just getting in now.
Heading into the flat, the other crew tell us that we're not needed.
Yeah, I'll leave you.
Yes, if you could.
Yeah, you're quite happy.
They're so calm, I don't really grasp what's happened.
There's a crew already here.
Don't start. No shit. That's why we're not required. The crew will deal with the police and the doctor and all the things that need to be done now. But we're not required. But she's already done. She's died very peacefully.
God, that's not the way you want to start off.
When that call comes through of a cardiac arrest, does it cross your mind on the journey there that that's someone's mother, sister, daughter, and do you feel any emotion about that? Do you get quite emotional on the way there?
What I think about is to get there safely, and then you're much more of use to a family rather than being emotional on the way there, crashing the vehicle, not getting there at all. And also, families don't need crying paramedics. They need sensible and someone who's able to deal with it.
At this time of year, it gets dark early. And it's not long before we get our next call.
Very calm.
It's into rush hour, Mari has to weave through the traffic.
It always amazes me that when you're on the wrong side of the road, driving head on to someone, that they'll not move.
Did you hear your sentence then? When you're driving on the wrong side of the road, head on into somebody. All words I never thought would be in one sentence and uttered to me whilst in a car on the wrong side of the road. Oh, I've just been tensing my right foot a lot.
Are you braking?
I was braking actually, yeah.
I've got the brakes. You're
I was braking.
I've got it covered.
I was braking.
I can see it.
When we get to the address, Mari has to treat an elderly lady who's fallen down the stairs. The injured woman asks us not to film, but slips, trips and falls provide plenty of patience for paramedics. And when I'm on shift with her another night, Mari gets called out to a similar accident.
Mari, you're going for a 40-year-old male who's fallen down the stairs. It confirmed that he was unconscious, but now it's reading that he is conscious and breathing. I'll be getting you back up as soon as over.
Thank you.
That sounds quite serious. A 40-year-old that's fallen down some steps.
He's outside in the street. See him?
The man has fallen backwards down the stairs of his hotel after returning from a heavy drinking session. His friends, also under the influence of alcohol, are standing round him, as well as the hotel manager.
What's happening here?
He's fallen from the stairs.
He fell,
Yeah, he was more or less at the third stop.
Going up the way, coming down the way?
Going up the way.
From the ambulance.
The man's been sick and is not communicating clearly. It could just be the effects of the alcohol, but Mari cannot rule out the possibility of a head injury.
What happened, Jay? Where are you sore? Where are you sore, pal? Tell me if you're sore anywhere. You get any pain in your neck? We're here to help you.
It's getting cold. You shouldn't walk barefoot.
Mr. Korch.
Don't call me Mr. Korch.
Then how should I address you?
Call me your husband. Have some. It tastes good.
Thank you so much. No one's ever been so kind to me.
You've had a fall. You've fallen down the stairs. You just lie still for me just now.
Mari's checking her patient's vital signs while waiting for ambulance backup.
Given the fact that he's already had quite a bit of vomit, I'd rather he was laid on his back for as short a time as possible. So once the crew arrive, we'll get him moved out.
If he were to throw up while on his back, there is a danger the man could start to choke on his own vomit. Until further help arrives, Mari wants him to remain on his side and as still as possible.
Where are you going?
But then he starts to move.
You just get ready to move back.
Mari withdraws, knowing that if she forcibly tries to keep him on the ground, the struggle could cause the man more harm.
Sometimes you're better off there you go.
The ambulance crew have now arrived to provide extra hands and transport the patient.
You're all right, you're in. Initially, fairly flat, vomited a fair bit. To be honest with you, he's quite difficult to keep flat on the floor. He was lying quite still initially.
Fortunately, there is no obvious wound to the man's head, and he seems to have escaped serious injury.
You need to sit back down.
Sit back. Come on, sit back for me.
But to be on the safe side, he'll be given a thorough check over at a hospital.
Take that collar, or are you okay? Give them 2 seconds to sort him out, yeah.
It was quite a hefty fall that he'd taken there, and I was quite surprised when he'd started
getting up.
Trying to get up.
There.
And what you did when that happened was hands off, wasn't it?
Clearly you want to clear his neck and you want to make sure that he's got no neck injury, no back injury. However, if he decides to get up and you've held him down, the pressure that he exerts fighting against you could potentially make a neck injury worse.
I would be nervous about going to that scene on my own. I know I'm with you this evening, but I'm not always here. You're on your own a lot. You'd still have got out.
Of course. It might have been different had there been a big crowd around him. or had his friends been a bit more aggressive, and if necessary then it's withdraw quickly.
It must take quite a bit of time to get to that way,
It's a steep learning curve.
Yeah, I bet it's a steep learning curve. God, not half.
Yeah.
Not half.
After an examination in A&E, the man was found to have only minor cuts and bruises and was discharged a few hours later. Another part of the city, and ambulance crew Leslie and Martin are on their way to an urgent call. Paramedic Leslie has been with the Scottish Ambulance Service for 13 years, while Martin, who's also a paramedic, has 12 years' experience.
It's an 8-year-old boy with chest and abdominal pain. I think he's been in hospital recently.
Leslie's been told the boy they're going to has a complicated medical history, so she'll need all of her monitoring equipment. Upstairs, they find Mark being cradled by his mum, Karen. He looks very unwell.
Hey, you're not feeling that great. What's up?
He said his tummy's sore up here and then down at the bottom. It was like cold sweat he came out in.
Young Mark has only recently got over a serious illness. Last month, on holiday in Cyprus, he contracted pneumonia and an infection in his chest. After 2 emergency operations to drain fluid from his lungs, he was airlifted back to Glasgow to recover. 6 days out of hospital, his parents are desperately worried that the problem has returned. Coming up, Leslie needs to get Mark straight back to hospital. Desperately ill, frightened and refusing to go to hospital, the medics' power of persuasion are put to the test.
We'll get you in the ambulance in a minute.
Oh no, I ain't going in there.
Look, I'm actually a bit worried about you.
That isn't fair on you, not fair on you, missus.
Paramedics Leslie and Martin have been called out to a young boy, Mark. In the last 3 weeks, he's had 2 emergency operations after falling seriously ill on holiday in Cyprus. Now he seems to have taken another turn for the worse.
What was the surgery for?
Pneumonia and air and liquid in his lungs.
Right.
You want to show?
Is it okay to have a wee look? Can you get...
6 days ago, Mark was airlifted back from Cyprus to recover in hospital in Glasgow. And 2 days ago, his parents finally got him home. But the fear is that the pneumonia has come back.
Mark, whereabouts is your tummy sore? Can you point to where it's sore?
Up here.
Just at the top of your tummy? Okay, is it sore if you move about? And if you take a big deep breath, can you take a deep breath? Does that make the pain any worse?
No.
Just stays the same?
It's just that we know there is an air pocket in the chest cavity. They told us that there's still a thorax there, but our concern is that it's expanding again and coming back.
Yeah.
He's lost a lot of weight and muscle mass because of the illness, so that's kind of
floored him, hasn't it?
Yeah, floored him quite a bit.
Okay, is the pain there all the time, Mark? Or does it sort of come and go?
It just comes and goes.
Right.
Leslie wants to check Mark's vital signs.
It's not good for you. You're not meant to be on it forever. And I was on it for a long time. I'm talking pain relief at the highest level, all sorts of horrible stuff. Now I don't have to depend on medication. I think that's a real compliment to the people that have designed this chair. My name's Warren Laws, and this is where I run my guitar making operation.
Mum will move you.
In the past month, he's already had to get over 2 bouts of surgery to drain the dangerous amounts of fluid that had built up on his lungs. So for a little boy, he's had more than his fair share of hospitals and medical procedures.
That could be tiredness with you.
You should be sleeping, Mark, eh?
I'm 7, so I'm supposed to be up this late. You're not supposed to be up this late.
You're a big boy.
Leslie isn't going to take any chances. Mark will be going to hospital once more.
I think just obviously with his history as well, regarding what's happened recently, it would just be better to take him back to York Hill, get him a check-up up there.
just a couple of checks to do them, and then we'll get them.
Mark's okay just to put these wee sticky things on your chest. You've probably had these on before, haven't you?
With such a complicated medical history, Leslie wants to keep Mark wired up to a heart monitor for the journey to hospital. It will warn them if his condition takes a sudden downturn.
What's your meerkat called?
Samples.
Samples. Put these on. That's a wee bit cold, okay? Is your tummy sore to touch, Mark?
Yeah.
Just in here?
No, up here.
Is it sore to press in a wee bit? Yeah.
As one of the after effects of his illness, Mark was left with pockets of air in his lungs. His doctors figured the best treatment for these was to let them disperse naturally over time. His parents are worried that one of these air pockets has moved somewhere it shouldn't.
Good stuff.
He's been through a lot, but there's one thing Mark still hasn't got used to. Needles.
You had the wee test done where we take a wee spot of blood off your finger, Mark. Have you had that before? You can say no if you want. Don't worry.
Nah, it's
It's
all right.
alright.
Do the boss, Mark.
You can decide. Don't worry about it.
If they do it here, or they'll do it in the hospital anyway.
I like it in the hospital.
Oh,
Fair
well,
enough.
we'll let them do it. No problem.
Mark's feeling a bit tight in the chest, so Leslie gives him an oxygen mask to help his breathing. Leslie and Martin will hand over Mark's care to the doctors at the emergency department. For the family, it's an unwanted return to the hospital they left just 2 days earlier. At hospital, doctors said the pain Mark was feeling was a result of the surplus air pockets in his body dispersing naturally. Uncomfortable, but not dangerous. Later that evening, he felt well enough to be allowed home, and he'll be seeing a consultant soon, just to check everything's okay. Covering 4 counties, the South Western Ambulance Service deals with well over 400,000 999 calls a year. And in their Exeter Control Centre, it's another busy day for the emergency call takers.
Thank you. And what's the reason for your call?
As well as sending ambulances, they have a team of doctors that they can page and dispatch to emergencies. Using their own adapted lightweight cars, these doctors give their time voluntarily. Today at Derriford Ambulance Station in Plymouth, I'm joining one of them on shift.
Hello.
Hello there.
Morning.
Nice to see you.
Angela, nice to meet you.
Hi, Angela. I'm Tony.
Hello, Tony. Now you've got red bits, which means that you are a doctor.
That's right. I'm a part of a big organisation called Basics, which is the British Association for Immediate Care, and that's a countrywide organisation.
Okay. So in the car, have we got the usual paramedic stuff and a few extras?
And a bit of value added. Yes, I've got a few extra.
Value added, I like that.
Yeah, a few extra bits and pieces.
Okay, like for example.
For example, we've got surgical equipment just in case we had to do anything surgical at the roadside.
Like what?
Well, occasionally people have required roadside amputations, and then that would be an absolute last resort.
Get lost.
We do have the kit to do it if we need to.
A GP trained in trauma medicine, Tony has been a basics doctor for over 20 years.
All right, well let's get on the road and book ourselves on and see what the day brings.
Okay, we'll do that.
And anything I can do to help you today, just
call.
let me know.
Just out of the garage, a job comes through from control. It's a code red, the most urgent.
So we're going to a 71-year-old who's having difficulty breathing, and we're not too far away from the call.
Tony has been sent to a man in a potentially critical condition. Within minutes, we arrive at the address, a large tower block. We're expected.
Thank you, my love.
Residents hold doors. The lift has been called.
Top floor.
They are doing everything they can to get us to this patient as quickly as possible. We're in. At the tower's summit, the man's wife leads us to her husband. He's gasping, fighting for every breath.
What's your name, bud?
Nick.
You're a bit breathless there, my old love, aren't you?
A bit. Been like this ever since I woke up this morning. I suffer with pulmonary disease.
Yeah.
Already suffering from serious lung disease, Vic's in a bad way. Tony knows he's going to have to go to hospital. Tony can't take patients in his car, so an ambulance crew has arrived.
You've got a chest infection, Vic, and I think it's put a bit of strain on your heart, and your heart's having to work quite hard. And because of that, you've got a bit of fluid on your lungs and on your legs as well. So I think that's enough, isn't it?
What's the problem? What's wrong?
So Vic's got chronic lung disease, probably due to smoking. Because of that, his lungs are weak. He's got an active chest infection at the moment, putting a lot of strain on his lungs, which in turn put a lot of strain on the heart. He needs to have an intravenous infusion. He needs to have drugs to get the fluid out of his system.
The medics know they don't have much time to get Vic the treatment he needs.
We'll get you in the ambulance in a minute.
Oh, no, I ain't going in there.
Yeah, Vic, no, I want to, mate.
But then, a problem. Vic is refusing to go to hospital.
Look, I'm actually a bit worried about you, to be honest with you, because I don't think you're that great at the moment.
No, and I'm going to be bloody worse if I go in there.
Tony has to persuade him, fast.
I'll sooner have treatment home here.
Yeah, but you're pretty poorly for that, Vic. I wouldn't want to leave you here like this, that's for sure.
I'll do and say anything to stay home.
Paramedic Mark steps in to help.
If you were to get up, mate, and go to the toilet, you'll be out of breath by the time you get there, wouldn't you?
He does that. I already have.
Yeah, I know, mate. But that's not fair,
I
is it?
almost couldn't do anything.
Vic, that isn't fair on you, not fair on your missus. You need to get that infection knocked on the head. We can make you better. I promise you that.
You can get worse, and the trouble is the next stage after worse is actually...
worse, I'll bloody stuff it.
Say that actually, my handsome. Yeah.
The medics seem to be making progress, but moving Vic to the ambulance chair, he suddenly panics.
No.
All right, mate?
No.
Vic, we need you to calm down, mate. Come on, mate. Listen, slow everything down, Vic. You're going to be just fine.
Vic's heart is already under strain. Dr. Tony knows it could fail at any time.
You've got plenty going in, I promise you.
They need to get him out of here.
I'll tell you what, shall we just try and give you something here?
No.
We're not going to do anything without your consent.
No.
But Vic's agitated and in pain.
No.
Well done, Vic. You're doing well. You're doing well, mate. Come on.
I'm really scared.
Yeah, I know you are.
Persuasion isn't working, so Tony decides to try something stronger.
Vic, would you let me just pop a needle in your arm and give you something to sort of ease that off a bit?
You can stick a needle anywhere.
So this is
morphine.
Okay, so
which
this
in
is
heart failure is a useful drug as a relaxant, really. We'll just give him a small amount of this to calm him down and make him a bit happier. They're going to hospital, really. How are we doing? Vic, I'm going to give you a little tiny bit of morphine now to help your breathing, help you relax.
Morphine?
Yeah.
I've had some. They are morphine.
I'm only going to give you a small amount, but it'll be much more effective in through the vein.
Oh.
Okay?
Yeah.
Just a little bit.
As well as the morphine, Paramedic Mark will give Vic a dose of GTN spray. This widens the blood vessels and makes it easier for his heart to keep pumping.
Vic, lift your tongue for me, my boy.
Angela, could you just note the time?
Yep.
That's it. Hold on. About 400 mics.
1:05, 13:05.
All right. Doesn't taste very nice, does it?
The calming effect of the morphine works, and Vic allows them to take him to the ambulance. His wife Ronnie will follow us to the hospital. But Vic is far from out of danger. We go on blue lights to the hospital as Tony knows Vic's heart could give out at any moment.
Yeah, he is very poorly at the moment. He could actually have a cardiac arrest.
The breathing's getting heavy again.
All right, mate, I'll probably give you a little bit more medicine then.
I tried to do my bit as well.
Sorted you out before. You can do it again.
The A&E department at Derriford Hospital have been warned ahead about Vic's arrival.
So he's going to go straight into resus now?
I'll go into resus. Hopefully he'll go straight in. We'll give him the handover. I'll go let him know.
He's really poorly. I mean, he was literally in the middle of heart failure. Because of the way that the paramedics speak to each other, there's almost a code of language so that everyone knows how important and poorly someone is, but without kind of making the entire household dissolve into hysterics. But he's really, really poorly.
In resus, doctors brought Vic's heart and breathing under control and down from a critical level. But his cardiac and pulmonary disease had flared up to such an extent that he never made a full recovery. And sadly, less than 6 months later, he passed away. Coming up, A man has suffered a massive internal hemorrhage and has vomited up a potentially fatal amount of blood. And we get sent to a very alarming call.
It's been described that there's blood pumping out of a little girl or boy's head.
Four years, $100,000. That's what your degree cost. AI skills, 28 days, $20. And in 2026, your boss only cares about one of those. Figure it out.
Never, and I mean never, learn AI until you've watched this video.
I mean, AI can now build a website in 90 seconds,
Yeah.
while the only AI most people over 40 know is ChatGPT.
Yeah.
How long before I see results with AI challenge?
In 1 week, you'll feel unstoppable. In 2 weeks, you'll know more than 90% of people of your age. In a month, you'll have your entire AI strategy.
So what should I do?
Just download Coursive, use it for 15 minutes a day, and finally become a master of AI tools. By the end of a month, you won't recognize yourself.
I'm out in a rapid response car with emergency doctor Tony Golding Cook. He's a GP, but volunteers several days a month to respond to 999 calls.
We received a call from therapy.
Trained in trauma care, he's there to provide backup to the ambulance service on the most serious incidents. We're coming to the end of a day shift in Plymouth when control radio through. A child has been hurt.
So it's just coming up to 5 o'clock now. It's just starting to get a bit dark, and we're on our way to a 3-year-old who apparently has fallen over and hit their head.
We're being sent as we are the nearest emergency vehicle.
It's been described that there's blood pumping out of the little girl or boy's head. Blood pumping out of head isn't a good thing.
No, blood volume is limited, so we don't want it pumping.
No, I hate going to kids. I absolutely can't bear it.
That's all right. Is that okay?
Yes, fine.
Hello, gorgeous. What's your name?
Kaylee.
Kaylee, what's happened? What's
She sat on there and she was swinging and she fell back and smacked her head on the floor.
Bang head?
It's reassuring that the child Kaylee is standing at least.
Was she not better, Tom?
No, she cried straight away.
It's also encouraging that Kaylee cried immediately after falling. It means she didn't lose consciousness, often the sign of a serious head injury.
What are we going to find in here, do you think, eh?
But there's still a danger of concussion.
Should we take that out, that little rubber band, so we can have a better look? Oh, you are a brave girl. How old are you, Kaylee? 3.
Blood pressure around the skull is high, so head wounds can bleed heavily. To try and stop it flowing, Mum Samantha has improvised a field dressing.
I've got a nappy on it, so...
Yeah, it's just handy to have,
Some
isn't
of
it?
it inside out.
Oh, darling, what are we going to do here, eh?
We're just out having a little walk.
We're coming home from school.
Tony ropes in Kaylee's big sister to help out while he sets up his car as a makeshift surgery.
Yeah, Mummy's staying with you.
Okay, sweetie, it's going to just feel a bit cold for a minute, okay?
Giving the wound a thorough clean, he can see there is no need for any stitches.
It's about what you need to look out for, okay?
Next, Tony checks how Kaylee's pupils respond to the light. This tells him she hasn't suffered a more serious head injury. As a doctor, Tony can do all the tests that might have taken up time at the emergency department in hospital. He decides that Kaylee is fine to go home.
It's a big, big bandage for a little head.
Oh, wow,
but you don't need it for very long. So you've got a turban now. Right. That's just till you get home.
I do.
Should be
I
fine.
take it off. All sorted. You've had the sign off from the doctor and everything's all right and you've been very, very, very brave.
So thank you.
We'll let you get home and out of the rain. See you later. Bye.
It was minor abrasions, no real laceration, nothing needing suturing, nothing needing gluing.
Great.
So I've just given Mum head injury advice. We've put a dressing on it. Should be absolutely fine.
Yeah.
She'll be watching telly in half an hour.
All right then, that's that.
Are we available again?
We are available.
It's rush hour time. We're in the city centre. Let's see what happens.
Oh. Across the city, the night shift is just starting. On standby in Plymouth City Centre are Nick Pearce and Steve Haggett. And now they've got a job.
Got an emergency call, no further details.
Paramedic Nick has been with the South Western Ambulance Service for 10 years. Steve is an emergency care assistant. He has 6 years' experience. And details are scarce about what they're going to. All they know is that they're being sent to an address where a man has lost a lot of blood. And getting there, they're about to be confronted by a shocking sight.
Is it your husband that we've come for, my love?
Yes.
Directed upstairs to the bathroom by the man's wife, Nick is taken aback by what he sees.
Oh, hello, sir.
John has suffered a massive internal hemorrhage and has vomited a lot of blood.
Has this ever happened before? No. Yeah. You've not got any underlying ulcers or gastric problems? No.
Nick can see that John's lost a lot of blood. It could put a catastrophic strain on his system.
No pains in your chest? John, obviously we'll be taking you to hospital. Okay.
John's blood pressure is at a dangerously low level.
Ideally, because your blood pressure's low, we need to get you laid down, you know?
John's dehydrated and he may still be bleeding internally.
Can I have a look at his hand as well there, buddy?
The very low blood pressure readings suggest there may not be enough blood in his body to keep his heart pumping properly.
Steve, should we get the scoop, mate? Get him laid down and we'll get another crew, mate. Got quite a heavy hemorrhage here.
Any exertion could tip John over the edge. Even sitting up could be too much. So they will lie him down to take the strain off his heart.
Before we move you, probably going to put a little plastic tube into your vein, okay? Just to support your circulation.
By putting John on a drip, they can get some fluid back into his body. They hope this will have the effect of helping to raise his blood pressure. For John and his wife Anne, it's a mystery why this has happened.
Well, he's been ill for the last fortnight. The left-hand side of his throat is closed over and he hasn't been able to swallow or anything. He's only been to the doctor 3 times. He's lived here for 20 years. In fact, he's quite healthy, actually.
But not now.
Obviously, we would normally just take you on a chair, all right? But because obviously your blood pressure's low, we want to try and get that off as soon as possible, okay?
Between them, Steve and Nick managed to get John onto a stretcher. But to get him downstairs, they'll need reinforcements.
Yeah, don't worry.
I won't.
Do you have any pain in your throat, John?
No, I have had for 2 weeks.
Right, yeah.
A second crew has been called for and arrives. Nick quickly updates them.
No radio. Stomach about 70.
No radial means they can't feel a pulse in John's wrist. They want to get him to hospital as soon as possible, yet they need to be careful getting him into the ambulance.
You're at the door now, mate.
A little bump as we come in here, John. All right, sir. How are you feeling now, sir?
Better than I did.
John may sound better, but the team don't know what's caused this.
Have you got any pain in your tummy at all, John?
No, honestly.
No tenderness?
No, nothing.
So he could suffer another large bleed at any time.
As you can see, he's had a massive hemorrhage, either from his throat or sort of gastric tract. It was obviously, very low initially inside. So our main concern is sort of hypovolemic shock.
Hypovolemic shock happens when a person loses more than 1/5 of the blood in their body and the heart doesn't have enough to work. Until they're sure he stopped bleeding, John will stay connected to the drip all the way to the hospital.
That's a lot better.
And on the journey, John's blood pressure finally reaches a more normal level. Now he seems to be out of immediate danger, Nick lets him know what a close call this was.
We're a lot more happier now that, we've managed to stabilise you, but initially you're a very poorly man.
Thank you very much.
Going down, John.
The hospital's emergency department will take over John's treatment. He'll undergo a series of tests as doctors search for an explanation as to what's caused this.
John, all the best, buddy. All right.
John's just grateful he's around to find out himself.
Nick was brilliant. Got me sorted out.
If he continued to bleed, continued to have a hemorrhage, and continued to have hypovolemic shock, yes, he could have died. He obviously knew he was extremely poorly, and now in the space of a half hour, he feels a lot better, and it's very rewarding to see that.
A few weeks on, John was diagnosed with Barrett's syndrome. It means his stomach produces too much acid, which burns the esophagus, causing bleeding. He's now on medication. Thanks to Nick's calm thinking, a potentially critical situation was averted.
I think part of how a paramedic can deal with their daily life is the fact that they only nip into people's lives for about 20 minutes. They go, they assess, and they then transport people into hospital. But being on the cars, because if that person needs transporting in, you have to wait for an ambulance to come, and you actually end up getting more involved with the patient. You get to know more about them, but I suppose that means that you give them a little bit of your heart as well.